to our hope discussion. Hope to stay healthy, live longer, to improve the quality of life and to extend lifespan itself. So today we'll talk about another very important vitamin. In fact, it functions more like a hormone than a vitamin. This is vitamin D, the sunshine vitamin. Unfortunately, one of the most critical vitamin for our health. The health of almost every cell in our body is largely deficient because we have changed our lifestyle. We have become indoor beings during the day and we have become outdoor beings at night. Our activities are mostly at night. So we lack the sunlight, so we have become deficient in vitamin C, including children, unfortunately. I have tested more than 1,000 patients so far, the levels of vitamin C in their blood. I hardly ever see one who has optimum levels. Majority are insufficient and a significant number of them are actually deficient in vitamin D. So vitamin D is another important vitamin or a hormone that evolutionarily it has become so important for every cellular function. So you get it from exposing yourself to sunlight, the UVB portion of the sunlight, and the best time you make vitamin D in your body is if you expose yourself to sunlight at about noon time. Of course, it depends on how long you expose yourself, and at least 1/3 of the body must be exposed, not over the clothes. Lighter skin people, it's sufficient if you expose yourself to about 15 minutes at least 3 times a week. If you are the darker skin people, then you may have to expose yourself to a bit longer, 20 to 30 minutes. Children should play outdoors at least a few times a week. They can make it easy. So one of the most important reasons why we have become deficient in vitamin D is because we don't go out and expose ourselves to the sunlight. It is also because obesity has become so common. Someone who's obese, the vitamin D tends to be locked up in the fat cells and not available for the system use. So obesity means you become tired of exercising, you are lazy, you are a potato couch, and by staying indoors because you're obese and lack of activities outdoor, you become only more deficient in vitamin D. So it becomes a very vicious cycle. One of the things that is not mentioned about the side effects of statins, there are many side effects of statins. One of that is vitamin D deficiency. Now remember, vitamin D is made from cholesterol in the skin. Then it has to be activated, the first step in the liver and the second step in your kidneys. So if someone is taking statins to reduce the cholesterol levels, obviously that person is going to become deficient in vitamin D. And vitamin D deficiency is associated with many of the chronic degenerative diseases, autoimmune diseases, cancers, and your risk to pathogenic invasion, viruses. Now, you can see from many studies that influenza is more common during winter months because of the lack of sunlight and acute deficiency in vitamin D. So statins reduce cholesterol and thereby cause vitamin D deficiency. The other important factor is, unfortunately, someone who's hospitalized, say in this case because of the COVID-19. If you get hospitalized, one of the most important reasons that you are not able to defend yourself against the virus is vitamin D deficiency. Once you become hospitalized, you become even more deficient. So where there is hope of healing in such patients if vitamin D deficiency is not corrected. And now unfortunately you're asked to be quarantined. So when you stay indoors, you become more deficient. So at least some outdoor activities exposing yourself to sunlight is important. So if there is a change in your lifestyle, you don't get exposure to sun, and if you are living in countries where long winters without sunlight, you become more deficient. If you are obese, you become deficient. Statins cause deficiency. Hospitalized patients are already deficient and they become even more deficient during hospital stay. So what does vitamin D do? Now vitamin D, we now know that almost every cell in the body needs vitamin D for optimum function. The reason is the vitamin D receptors or VDRs have been found in almost all the cells. So why would your cell have a receptor if it does not require the molecule vitamin D? So it is systemic benefit. Vitamin D helps in the function of many parts of the body. So one of the most important function of vitamin D is to boost your immune system. Now it works both on the innate immune system as well as the adaptive immune system. Now the beauty of vitamin D is because it helps to activate the macrophages, and also we will talk about an antimicrobial agent that the macrophages produce. Now remember, the innate is the first line of defense. As the pathogen comes in, they are the ones who respond. Then if necessary, body activates the adaptive immune system consisting of the B and T cells, which I mentioned in my previous video. Now macrophages function to engulf the pathogen. So you need this first line defense, and vitamin D is very important for optimum function of these macrophages. So this is where you prevent. Whereas vaccines, they work by working on the adaptive immune system, where the antibody to the particular virus or the pathogen is induced in the body, and subsequent exposure, your body will recognize this as a foreign pathogen and attacks it. So this is not the first line of defense. Vaccines are not the first line of defense. And there is always a delayed response because the body formation of antibodies and also cytokines by the T cells needs a lot of intercellular communication. It's not going to be instant. The instant benefit comes from optimizing your macrophages. So vitamin D is very important for macrophage function. Now it is also necessary, as I mentioned, for B cell and T cell function. So when this happens, vitamin D is able to balance your immune system. So what it does is, besides improving the immune system, it allows your immune system to balance its activity. So immune system works by inducing inflammatory changes and cytokines. Now these cytokines are necessary to kill the foreign invaders, including cancer cells. But a dysfunctional immune system can overreact. And overreact means in the sense that it produces too much of cytokine, we call it cytokine storm, and that causes so much of inflammatory damage to your cells, and that is the primary reason for ARDS. So you need to have a balanced immune system where it produces the amount of cytokines or inflammatory changes that is necessary to kill the invading pathogen without damaging cell. Now this aspect of balancing the immune system is done beautifully by vitamin D, and please remember magnesium is also very important for this balancing function of the immune system. Now macrophages, how do they kill the pathogens is Once they engulf, they produce antimicrobial agents or proteins called cathelicidin. Now, in order for macrophages to produce these cathelicidins, you need vitamin D. So if you are deficient in vitamin D, macrophage function becomes ineffective and you do not produce this important protein that kills the foreign pathogens. Remember, first line of defense. Now, but the pathogens are also very smart. Like for example, in tuberculosis, the mycobacterium produces a type of protein called snail that actually deactivates the vitamin D, because your body is very smart. It has its own defense mechanisms, and so do pathogens. So they have their own defense mechanisms. So bacteria and other pathogens, possibly they can deactivate the vitamin D in your body so that they protect themselves. So this underscores one important point. Why do you need a lot more vitamin D when you are having an infection? Because you need to overcome this resistance. Okay? Now, so the question comes back to whether vitamin D is useful. Are there evidences? But it's sad to say that the evidences is not looked at by conventional medicine. There are more than 1,000 papers published, and some of the papers have been analyzed and reviewed. So there are very, very strong reviewed publications analyzing many of these studies, and they strongly suggest that vitamin D is safe. Vitamin D is very effective against infections, especially viral infections, and the reason is simple enough for somebody to understand that influenza is very common during winter months when there is either no sunlight for prolonged period of time or short duration every day. So all these are evidences, and I myself, as I say, in more than about 1,000 patients tested, I hardly see someone who is optimal. So if the governments or the healthcare providers start testing people's vitamin D, you would have already won the war. So how much is sufficient or optimal? If you test the levels, the new recommendation is if you have more than 50 nanograms per ml, 50, you are considered sufficient. But we do know someone who has about 100 have much better health than someone who is having less than 100. If you want to help someone to fight cancer or acute viral infections like this, you have to bring up the level to about 100. If the level is less than 30, you are insufficient. And if it is below 20, you are deficient. So this is the level that we should have. You should not be here. You should not be here. This is acceptable. This is optimal. So how much of vitamin D do you require? Generally, adults, if they take about 6,000 international units per day, it is sufficient. And children can take 1,000 to 2,000 per day. But generally, what I advise for children is let them play outside in the sun and make their own vitamin D. But the older you are, even with sun exposure, the ability to make vitamin D becomes less. So this is a standard dose. But when you are trying to fight a viral infection or you are trying to fight cancers, then you need to increase the dose. The best way is to do blood tests. If not, what is generally recommended is even up to 50,000 international units for a few days to a week, and then you can go on to the normal dosing. But the best is still blood level that can give you the guidance as to how long do you have to continue the high dose of vitamin C. Now vitamin D, of course, it's a fat soluble vitamin. So overdosing is not good, but we hardly see toxicity. So Be safe in how much of vitamin D you take. 6,000 for adults, 1 to 2,000 for children. When you are healthy, if you have an infection, if you are trying to fight a disease, you may require higher dose of vitamin D, and the dose can be even up to 50,000 international units per day for a short period of time, and then you start taking the normal dose. So if this information is available to all of you, I believe that you can have a robust immune system and you will be able to either prevent these viral infections or overcome in a shorter period of time without getting into complications if you optimize your vitamin D levels. Stay healthy and thank you for watching.